That's right. Today, we are going to focus on what we are calling the South Asia Roundtable. Remember, 20% of the world's population lives in the SAARC area. And yet, when you look at the total number of cases, we are doing much better than most other parts of the world. What exactly is the reason for our success? I'm going to be joined from Nepal by Dr. Runa Jha, she's Director, National Public Health Laboratory, by Lieutenant General Shavendra Silva, Commander of the Sri Lanka Army and part of their task force on COVID, Dr. Naseem Akhtar, Pakistan Institute of Medical Sciences, also part of their COVID task force, Professor Dr. A.F.M. Ruhal Haq, former Health Minister of Bangladesh, and Dr. K. Srinath Reddy, President of the Public Health Foundation of India. It's great to have all of you on the show. I'm going to come to you all in a minute, but first, let's take a look at why we are making this our major talking point. Remember, for years, for decades, South Asia has been dubbed as a region that lacks health systems. It is seen as a region that has the largest amount of people below the poverty line, and yet it has outperformed the West, Europe and America when it comes to the COVID fight. What appears to have worked in favor of South Asian nations, some say, is the timely imposition of the lockdown. Others say a younger population. And there is the immunity theory. What really explains the fact that South Asia is getting it right, where the mighty United States and Europe are getting it wrong? It's our top story tonight.
COVID-19 has redefined the global order and supremacy of nations and regions. While the West and the Far East are experiencing the worst of the pandemic, South Asia has fared much better. But how has South Asia done that?
India has started later than other countries in terms of actual exposure, but it has managed to contain the dissemination quite well. And we definitely need to ramp up our health systems and social systems further.
It's not just affirmative policies, but lack of sturdy public health systems in South Asia that forced the governments in the region to order lockdowns. And it did make a difference in India, Bangladesh, Pakistan, Sri Lanka and Nepal, where lockdowns started in the last week of March. The common purpose was to break the chain of transmission through physical distancing. In Pakistan and Bangladesh, there is a fear of increase due to violations of the lockdown during the holy month of Ramadan.
कि अल्लाह के घर में जो बीमारी होती है ना ये असर नहीं करती अल्लाह के घर में शिफा मिलती है यहाँ पे बीमार भी आता है ना वो तंदुरुस्त हो जाता है.
The other important factor is the age median. Compared to the West, the average age of population in South Asia is under 30. COVID-19 is known to affect the vulnerable lot, the elderly.
कोरोना के वायरस की जो सीरियस मरीजों की फैसिलिटीज़ इस वक्त शहर में वो तकरीबन अपनी मैक्सिमम कैपेसिटी पे ऑलरेडी आ गई हैं, जबकि अभी ये मर्ज ने पीक नहीं किया है. अभी हम जो ग्राफ के इस तरफ है उल्टे हाथ.
And while the region can pat itself on the back for having handled the coronavirus pandemic well, there is much left to say about how it would manage the impending economic crisis. SAARC should not only look at an emergency COVID fund, but also focus its energies on economic relief. Bureau Report, India Today.
Okay, so we set the stage for the South Asia Roundtable, the first of its kind since this COVID-19 outbreak has broken. We are trying to melt borders. The big question is South Asia outperforming the West? What is working for South Asia? Is it too early to deliver a verdict on this South Asia versus West battle in a way against COVID? Let's turn to our panelists, and I want to go first to Pakistan, to Dr. Naseem Akhtar, because we want to get a voice from Pakistan at the moment. First of all, happy Ramadan, happy Ramzan to you, sir. I want to understand, you're in charge of the COVID-19 isolation ward at the Pakistan Institute of Medical Sciences. How would you describe the situation in Pakistan today? Is it fully under control? I see the Gallup poll has given Imran Khan's government about a 60% positive thumbs up.
Yeah, thank you so much for inviting me. And I think as far as Pakistan is concerned, our first case was reported on 25th of February.
Right.
And since then, the number of cases has gone up to now 12,227. And so far, 256 deaths has been reported. Um, I think it's very early to say that the number of cases is low at this moment in Southeast Asia, and especially if I talk about Pakistan, I think it's a bit earlier on. It's a bit early to say that we have less number of cases. But one thing is that after the outbreak started at Wuhan, I think we learned a number of lessons from the world so that we were able to take few steps. I think the
How
most
quickly-
important thing was
Yes.
the social messaging that we were able to convey our general public that how to avoid the dissemination of infection among the population.
But how
still, I
successful-
feel
how
that,
successful were you, Dr. Akhtar?
the testing capacity needs to be increased in most of the areas, because up till now, I think it also depends upon the testing capacities. If you are not testing much of the population, you can't say that your number is less. But still, as I can tell you that up till now, we are not receiving so much deaths as we heard in other part of the world. But I think there were a number of
Right.